A 67-year-old man comes to the physician because of 4-month history of fatigue and weight loss. Physical examination shows jaundice and the liver is palpated 3 centimeters below the right costal margin. Serum study shows elevated alpha-fetoprotein and prolonged prothrombin time. Genetic analysis of liver biopsy shows GC2TA transversion of codon 249 of gene coding TP53 protein in affected cells. Which of the following risk factor is most specific for this patient's condition? Remember, the patient is having genetic analysis, okay? TP53 mutation in codon 245. Yes, so the patient is having dietary aflatoxin exposure. So this is the most common cause of hepatocellular carcinoma in the patient who is having TP53 mutation. So all other causes some kind of symptoms before they progresses to hepatocellular carcinoma. Like this patient is only having symptoms of 4 months of history of fatigue. Alcoholism causes cirrhosis, hepatitis C infection, usually have increased liver transaminase. Schistosomiasis usually have some kind of infectious marker elevation. Anabolic steroid use usually have some gynecomastia or other symptoms. Hemochromatosis, they are most commonly present with bronze diabetes, like the skin will be bronze color and they will have diabetes mellitus. Okay, so all others have certain history, while dietary aflatoxins, which are actually derived from aspergillus. It's a fungus and it's only fungus that causes cancer.
Thanks for watching. Please give a thumbs up and subscribe for more.